Hi, good morning. This is Dr. Abolmaali with North Atlanta Plastic Surgery Group. Today I would like to answer one of the most common questions that I get asked about, and that's how to improve the appearance of a scar. Scars can happen obviously after traumas, lacerations versus surgery, and everyone is concerned about the scars. So there are two most important factors to improve the scars. One is to avoid UV light by sunscreen, and second one to apply some products which help to improve the texture and basically hydrate the scars. I would normally recommend the patients for the first 7 to 10 days before the sutures are removed and all the open areas are healed. I normally ask the patient to discuss it with the person who did the procedure to see how to deal with it, because depending on the sutures and depending on the closure, it might be different between each patient. But after the sutures are removed and all the areas are healed, basically I would recommend to twice daily, in the morning and at night, apply one type of silicone product over the scars or lacerations. If you use the gel, it's twice daily, one in the morning, one at night. It's like a gel product that you apply it over the scar. It doesn't have any residue, it's not oily, it gets absorbed to your skin. And what it does, it hydrates the scar and hydrates the skin, and also it helps to remodel the scar so it would leave the least amount of scarring afterwards. And maybe more important is to avoid UV light. So it's for the first week that you have sutures in place, I recommend my patients to keep your incision or laceration, especially it's on the arm or the face, covered up so it doesn't get exposed to light. And after the sutures are removed and all the open areas are healed, it's important to use sunscreen. My recommendation is get used to, first thing you wake up in the morning after washing your face, use your silicone gel and then put one layer of sunscreen over it. And if you go outside to the sun, I would recommend to renew your sunscreen every 1.5 to 2 hours. Get used to have a small bottle or a small, like a bomb shaped of the sunscreen in your pocket, especially if you're a male, because we don't carry a purse with us, to have it and just to renew the sunscreen over the scar area. Probably that's the most important thing which will help. If the scar or incision is on the body or the areas which are covered, it might be easier to use silicone sheets, which in one of the next video I'm gonna go over that with you. There are different shapes and different types, and they basically stay over your area of scarring all the time except for when you take a shower. It virtually like a band-aid that stays there, and you can re-wash it and reuse it again. And normally one should be enough for about 3 months, which is the duration we recommend to use the product. After 3 months, you just continue with the sunscreen. I normally recommend for 6 months to a year, and hopefully by then you should not be able to see the scar. I always correct patients after any type of injury or lacerations, you will have a scar. So what we are aiming to do is to make it as least noticeable as possible. So plastic surgery is about not having a scar, is about to have the least amount of noticeable scar. I hope this helped, and I'm gonna go over different types of silicone sheets and silicone products with you in the next video. Thank you.